Hey guys, it's Clay, CPAP My Way, CPAPMyWay.com. Today's going to be a different one. I had a really nice conversation with a Dr. Maria Guzman. She has a new practice where she is focusing on obesity and sleep medicine. It is a self-pay practice, mostly telemedicine. And I really thought it was a super unique plan, and it would be a really cool conversation. We got into all sorts of things, everything from her practice at DreamLife Medical to the history of how she ended up going into this particular thing versus going the insurance route, which many of you know how I feel about the insurance route. And then we also got into some deep details about funny side effects of sleep apnea, whether or not you should take melatonin or magnesium or even marijuana to help you sleep. So I found the conversation super interesting. I hope you will as well. If you did, I'd really appreciate that thumbs up. Subscribe if you want more info like this. And please comment with anything you like or dislike about this particular format. It's the first time I've done an interview with a doctor, and there's plenty more I could do. If you've got some questions you'd really like to address with doctors, or some things that really might make a good video in reference to, people that have more knowledge than me in the medical world, obviously, I'd be happy to find the right person and get them on the channel. So please let me know what you think. So we'll jump right into it. Enjoy the interview. All right. Well, Dr. Guzman, good to have you with me here today. I appreciate you making time for me and for the channel here. And I think this conversation will be really good for our viewers, as well as for people that are in need of sleep apnea treatment and maybe have some questions on the topic. So thank you.
Yeah, absolutely. Thank you, Clay. Thanks for having me.
Absolutely. So I was lucky enough for Summer at Fisher and Paykel, shout out to Summer, to introduce us and stop by your place recently. And it was really intriguing because you have a bit of a unique offering in comparison to a lot of the what I would call the insurance-driven world out there, where
Mhm.
a lot of people fit and a lot of people do just fine, but there's a ton of people that I think are in need of and would benefit from the the process that you're working towards here. And so I thought I'd definitely take some time to talk to you, not only about that and you, but also about, some questions I have about sleep apnea and some cool topics that I think we could dive into. So anyway, this is Dr. Guzman, everybody.
Yeah, thank you so much for having me, Clay. Just to give you a little bit of background on myself, I did my medical school in Miami, then did a internal medicine residency at Mayo Clinic in Florida, which is in Jacksonville, and then went for a 1 year sleep fellowship at Emory University, and then came back to Florida to private practice. I quickly learned that everything that I had spent, those 12 years of preparation for practice, the insurance-based model is really not serving patients where we need them to be served. And so I really very quickly recognized that. And there's a movement of doctors kind of trying to reinvent healthcare. And so that's where I'm at. That's why when we met, right, you were like, hey, this is a different take on how we can offer sleep care. So I also did my obesity medicine certification during that time, just recognizing the connection between sleep health and weight health, metabolic health, and the connection between patients who have obesity, who have more likelihood of developing sleep apnea, for example.
Nice. Yeah, those things kind of go hand in hand pretty often. Well, what got you into medicine in the first place? What was the beginning of your thoughts on that?
Yeah, I would say a passion for learning and a love for science. I really connected to the medical system in high school. My mom was having a lot of medical issues. She was seeing multiple specialists, and just seeing the impact that they made on her well-being really got me intrigued about, hey, this is something that I want to be able to help patients feel in the way that these doctors help my mom. And so that was my first kind of or the consolidating idea of, hey, let's pursue medicine. And then internal medicine in particular, it's a very multidisciplinary field. So we get to coordinate care between all the different specialties, and we get to diagnose disease from all of the different organs and how they connect to each other. So I've always kind of been driven towards preventative medicine in that way of how do we keep people healthy. In training at Mayo Clinic, see significant complex diseases, very advanced diseases, advanced cancer. And in many cases, many of the chronic diseases that we see as internists, they're preventable. There are obesity is a major cause of chronic disease. Um, and so that's what made me want to go into that. Obesity in many cases can be prevented. There are multiple causes of it. It's genetics, it's hormones, it's lifestyle, it's stress, it's poor sleep health, right? Sleep apnea can cause weight gain. And so that's where kind of I delved into the preventative aspect of let's keep people healthy before you get to having chronic kidney disease, end up on dialysis, or have a heart attack or have a stroke. Those are the biggest causes of mortality in our country.
It sounds like you started off in the internal med. What made you focus in on sleep medicine?
Yeah, sleep is kind of like it's like the underdog of medicine. Like it's really ignored for some reason. There's a shortage of sleep doctors. There's very few sleep fellowships where doctors can go do training, but yet we all sleep, right? And it's so important to every organ system. So e every organ system is either affected by sleep or it causes us to sleep, and it's important for sleep. And there's a famous quote by a sleep researcher, Alan Restrepo, who said, if sleep wasn't an absolutely vital function, then it's the biggest mistake the evolutionary process ever made, right? Because if we think about it from an evolution perspective, we are uh, vulnerable to predators when we're sleeping. We're not being productive biologically. We're not eating or hunting or procreating. So really, it's very inefficient. It's a very inefficient time, and we spend a third of our lives doing it, right? So why is that? Well, that's where we consolidate our memories, our learning, our experiences, our fears, our emotions. It's key to every aspect of not just mental health, but physical health. It's what when muscle recovery happens, our immune system regulation, a lot of it happens with hormones that are released during sleep. And so that's what intrigued me about it is just how important it is for prevention of chronic diseases. And it's also very multidisciplinary. So as a nerd, I want the multidisciplinary approach where I learn neurology, right? I'm looking at brain waves. I learn physiology of the pulmonary system and the cardiac system. And then there's a psychiatry aspect of sleep where mental health really impacts a person's tendency for insomnia, PTSD, and trauma impacts sleep function, may cause nightmares, recurrent nightmares. And so it's a fascinating field. And I hate how it's under recognized, but I'm excited to kind of spread more awareness about it. A lot of people think sleep doctor equals sleep apnea, sleep test, sleep apnea, CPAP, and then you may see your sleep doctor only once a year, once you're on a CPAP, but there's so much more to sleep health.
Yeah, that's really one of the biggest things you intrigued me with. You're more of an encompassing thing. Obviously, what we do here is CPAP, and so that's a big offering in sleep. But it seems like there's a lot more going on, and so we'll dive into that in a little bit here too, because you've got some interesting things that are coming down the pipe for sleep medicine that are pretty cool.
Mhm.
Um, and you said from Emory, right, to
Yeah,
practice in
that was my
Bradenton.
fellowship. Yeah, a private practice in Bradenton,
Okay.
doing both sleep and obesity, and really enjoyed that time just seeing how we can bring these two fields together in a private practice model. But at the same time, there's a gap in the care that we can provide. Reimbursements by insurance are dropping year to year, and that causes clinics to have to see many patients in a day. It shortens the time that you can spend with a patient. And in insomnia care, for example, which is a big passion of mine because it's so prevalent and we just don't know what to do with it except put a pill on it.
Hmm.
And many primary care doctors prescribe medications for insomnia, and a patient comes to a sleep doctor once they've tried seven different ones and it's no longer working. And we know from the sleep medicine guidelines that cognitive behavioral therapy is the first line treatment. It has no side effects. It's more effective than medications. There's a shortage, unfortunately, of cognitive behavioral therapy for insomnia providers. And so what I found very quickly is that I was just putting band-aids in private practice where you only have 20 minutes with a patient. All I can discuss in that time is like a little bit about your history and then spend some time discussing risks, benefits of different medications. all of those have side effects, right? So you may come back the next day and say, hey, maybe I'm sleeping more, but now I'm groggy during the day. And so
Hmm.
then we're trying to fix that and assess that. And so I really felt like I needed more time with patients to really do a comprehensive assessment of their sleep health. Um, and another gap is that insurance tries to drive what you can and cannot do as a doctor.
Yeah.
And I didn't go to med school for that, right? To play an insurance game where they increase or uh, inflate the cost of care. So, for example, a sleep study may cost $250, $200, but through insurance, it may actually cost $400. So I had a patient who the insurance was forcing us to do a home sleep study, even though I know they needed an in-lab study, but they were saying you have to do a home sleep study first. And they're charging this inflated cost, and the patient has a high deductible plan where they said, I can't pay $400 for this, and
Yeah.
then I have to pay for another one later on. So that patient didn't get the care that they needed
Yeah.
because of insurance.
Just to check a box.
Mhm.
Yeah,
Yeah.
I had a lot of the same uh, startup in that world. I was with an insurance-based home medical equipment provider for at least 10 years. It's hard to even remember now. But worked my way through it. And once I was in management, it was obvious I spent more time putting out fires and answering angry phone calls about billing issues and about people dissatisfied potentially with what options they had because it was really in the insurance world we were primarily concerned, unfortunately, and I won't speak for everybody in the insurance world, just what my
Yeah.
perspective of my experience was.
Right.
We focused a lot more on checking boxes and cutting whatever red tape was in the way to make sure that we were going to get paid. And that
Mhm.
is an incredibly important part of it, right? If the
Mhm.
provider isn't being paid, whether it's a doctor's office or the medical equipment provider, they go out of
Right.
business, and that doesn't help anybody, right? So
Right.
I do
Right.
understand that side of it, and there's certainly plenty of people that process um, benefits. It may be even a big majority of people, in my opinion, because if you've got good insurance and you're not having anything out of the ordinary go on, then the ordinary box checking may work wonderfully for you.
Yeah.
But like I was saying earlier, I think that there's a big call for even if it's 30% of people that really need a bit more attention, a bit more focus, or
Yeah.
maybe just something a little more outside the box. Um, I'm happy to see people like you beginning to offer something like that. So
Yeah.
it's
Yeah.
cool. Well,
Yeah.
tell me about
Absolutely.
your practice and how that vision has kind of shaped what you're doing now.
Yeah, so the name of my practice is called DreamLife Medicine and Wellness. And really the goal is to combine the fact that dreaming and sleep equals better health and better life, happier life. So I take a whole person approach to helping people with sleep and metabolic health disorders, really addressing both the mind and the body and assessing how those may be impacting their health and meeting people where they're at, knowing that each of us has unique needs, goals, and lifestyles, right? And I think people need to feel more empowered in their health, that they're not just getting a prescription. So I really resonate with the people who say, hey, what else can I do, right? Like, I don't want to take a pill. And there's a damage to the doctor-patient relationship that has been done through insurance because patients get angry at the doctor
Yeah.
when a medication is not covered or a CPAP is not paid for and they have to pay this big bill. And so I really want to help patients bridge that gap and offer evidence-based medicine, and whether that's medications or other treatments, but also let's rule out and let's evaluate the root cause of what's going on. Let's rule out that other aspects may be impacting this, and if we treat that, then your sleep is going to improve.
Yeah. Yeah, that's awesome. So, what's your website name?
Yeah, so you can find me at dreamlifemedical.com. I'm also on Instagram at dreamlifemedical. And I'm accepting patients for telemedicine in both Florida and Georgia, and in person here in Pinellas Park near St. Pete. So very excited to start that process. This is what's called a direct care specialty practice, where it's cash based, and we allow for longer appointments of 45, 60-minute visits, more
Hmm.
access to your doctor, more frequent appointments, right? If you go to a sleep clinic, number one, it may be hard to find a sleep doctor and you may be waiting months just to get a sleep evaluation. Uh, you get 20 minutes for that visit, and then it may take weeks to get a sleep study because of the shortage of in lab studies, in lab locations where you can get a study. So it could take months for you to really get answers as to what's affecting your sleep. So in the direct care model, we keep smaller panels so we can really give you more personalized care and more access to quicker care and more advanced results.
Cool. Well, let's pivot over into what your customer looks like. So, somebody coming to see you is potentially interested in just improving sleep, or they think they have sleep apnea, or what's the person looking for you?
Yeah, I would say anybody who's unsatisfied with their sleep.
Okay,
And according to the recent National Sleep Foundation survey, 6 out of 10 of us are unsatisfied with our sleep, right? And
that's
so we're either having trouble falling asleep, we're waking up when we don't want to, either 2, 3 a.m. We're waking up multiple times throughout the night, or we're excessively sleepy or experiencing fatigue during the day, right? I want to emphasize the fact that the sleep apnea is not the only sleep disorder. It's a very common sleep disorder, but there's a misconception that it's either sleep apnea or it's not. If you complain to your primary care doctor about your sleep, they may do an assessment, like it's called the stop bang score, where they rate, whether you have certain risk factors like high blood pressure, excess body weight. One of the scoring points is whether you're a man, and another one is whether you have a large neck, right? So women are often underserved by this screening tool, and they're not getting the sleep test, right? So they may say, well, you probably don't have sleep apnea, so let's just give you a sleeping pill, try that. And if that's not working, eventually we'll send you to a sleep doctor, right? So I want to meet the person when they're having the initial symptom, and let's really assess and rule out something like sleep apnea if you're perimenopausal or postmenopausal and you're having sleep issues, which can happen because of that hormonal dysregulation that happens around that time, or because you have more of a likelihood of sleep apnea with that hormonal change, hormonal transition. Muscles of the airway get weaker around that time, right? And so women may start to complain about their sleep. And in the primary care doctor's office, they may just kind of say, hey, you're in perimenopause, just kind of deal with it, or may be told to put their phones away before sleep and, like try not to stay in bed if you're not having trouble falling asleep, what we call sleep hygiene. But we know from the sleep medicine standpoint perspective, from the evidence-based perspective, sleep hygiene alone doesn't treat insomnia. It takes a little bit more than that, cognitive behavioral therapy. So there are more tools than that we can offer, and there are patients that are being underserved. So some the patients that can come to me are those that are really kind of they know something is wrong. They're experiencing the fatigue, the difficulty concentrating. They may need a nap during the day just to kind of make it through the day. And those are
hmm
the patients I want to see and just take a comprehensive assessment as to what could be going on.
Okay. Yeah, specifically my life, my wife uses CPAP every night. She would, she definitely wouldn't fit any of the molds. She's in great shape. She exercises, take great care of herself. Doesn't have like extreme daytime fatigue or anything, but there was some weird things like she obviously snored a little bit and she would grind her teeth. And since going on CPAP, she has obviously stopped the snoring. That's a no-brainer. But she stopped grinding her teeth, which was just a strange thing to me. I mean, even though I've been in dealing with people on CPAPs for a very long time, right? And I have never heard anybody talk about grinding their teeth. What is that common, or are there other weird things like that when it comes to sleep apnea?
Yeah, I would say many times a person may hear it from their dentist because they can see on your teeth that you've been grinding your teeth, which is called bruxism, or even TMJ specialists who, treat people with TMJ issues or pain. They may recognize it is a well-known cause, symptom of sleep apnea.
Huh.
It's not the most common symptoms like the excessive sleepiness, the snoring. For men, it tends to be loud snoring. For women, it's just a subtle snoring. But bruxism or grinding your teeth is a pretty significant symptom of it. And it gets better with treatment, right, as you discussed. And a lot of sleep dentists will do oral appliance treatment or oral appliance therapy where they fit you for a device that's personalized to you to move the jaw forward and keep the airway open in that sense, and it stops the teeth grinding as well.
Hmm.
Other symptoms might be like waking up often to go to the bathroom at night because of the respiratory physiology and the volume changes that happen when we're laying flat. If you have sleep apnea, it's more likely that you have this hormone that makes you want to go to the bathroom at night. So CPAP may actually treat that frequent urination at night.
Hmm. Yeah, I think you in a previous conversation you'd also told me something about acid reflux or something too is another weird one.
Yeah, yeah. If there's any weird symptoms that I've seen get better with sleep apnea, reflux is one of them. When we lay flat, there's more likelihood of acid from the stomach coming up into the esophagus, which is experienced as heartburn or reflux, and a person may need to kind of elevate the head of the bed, and maybe that can help. But CPAP may improve that because it keeps the airway open and it prevents that negative pressure from happening, which may cause that reflux to come up when the airway closes. And so by keeping the airway open, it's less likely that you have reflux coming back into the esophagus.
Yeah, I found that one kind of interesting. That's
Yeah,
I've heard a lot of different things over the years. Everything from, I don't have headaches in the morning or have more
yeah,
energy or I feel nothing at all. I mean, I've heard literally everything I think you can think of, but the acid reflux one was as surprising as the teeth grinding to me. I
yeah.
obviously if you're not breathing at night,
Mhm.
it can cause a lot of problems. That's pretty
Yeah,
layman's terms to me. If you just sat here all day and held your breath for 20 seconds every couple of minutes, you're probably gonna have a long day. So
yeah, yeah,
resolving that at night is probably a pretty important thing. And it's funny to hear all the different, whatever the terminology is for it, but the things that go along with it.
yeah, yeah, absolutely. Yeah.
Yeah. Well, what would it, uh, we run into a lot of people that have tried CPAP before. Um, for one reason or another, it didn't go well. Would any of those customers be people that would reach out to you about potentially trying to find some alternatives or trying to find something else?
Yeah, absolutely. I think there's misconceptions about CPAP too, right? That is like this big mask that you have to put over your whole face and it's super uncomfortable, or you may have claustrophobia with it. I think that are important to know are that it's going to take some time to get adjusted to it. In the insurance-based model, you may have a sleep study and then they diagnose sleep apnea, prescribe a CPAP. Then you're waiting maybe a few weeks, maybe a couple months before that DME company reaches out to you. They may drop off the CPAP and a couple of masks for you at your house, or they tell you to come pick it up. And then there's no real guidance as to how do I get used to it or what's a good fit for me. How do I assess if my mask is leaking? Am I actually getting the benefit from the pressure that it's set to? So there's a lot of things we can tweak once a person gets the device. What I would do differently is work with suppliers like yourself, right, to get patients a CPAP within a few days, within a couple of weeks, get them the resources and information and education of the benefits of different types of masks, the importance of trying multiple masks until you find the one that like you don't feel like it's on you, right? That you're sleeping comfortable with. And that may take months. For my
Mhm.
mom, it took her at least 6 months before she was consistently sleeping with it. My brother, he was trying it for a year, just on and off, just, it bothers me. And eventually you realize your body gets used to that on your face, right? So it doesn't disrupt your sleep anymore. And you start to see, wow, I sleep so much better when I wear it, right? So he got a little travel CPAP that he even wears on a flight because he
Mm.
gets so much better sleep on a flight, right? So there are, and insurance doesn't cover the travel CPAPs that are so much more convenient, comfortable, and easy to take with you and go on the road. So that's where you come in and say, and I can offer something like what you guys offer, which is alternatives and cash-based pricing and discounts for that.
Sure. Of course, you direct them to CPAP My Way's YouTube channel so they could learn everything they need to about.
Absolutely.
That's awesome.
Yeah, yeah. I saw your video comparing the different travel CPAPs, for example. And so you're spreading wonderful, valuable information that I think in an insurance-based system, you don't really see that. You
Right.
you really you get limited uh, benefit in that care that you get. You may see your doctor 3 months after you get the CPAP prescribed, and then that's when was finding out that you maybe used it 3 nights and you said the mask didn't fit, and
Yeah,
we've wasted 3 months of potential treatment. Or once you've been on CPAP for a while, you may only see your sleep doctor once a year, right, for the supplies to get insurance to cover those.
right.
But if you're unsatisfied with sleep, even while wearing a CPAP, even though you're getting the treatment, there's conditions where there's still sleepiness despite using CPAP, right? So there's more we can do, even if you feel like I'm doing the treatment, I'm still not feeling better. Get in with a sleep doctor and talk about it.
Sure. Yeah, I'd also put on that especially if you're in the insurance world there, advocate for yourself. Make sure you're reaching out to the medical equipment supplier as well as the doctor's office if something comes up. Chances are they've heard the issue before if they've dealt with CPAP for very long, and there's probably a simpler resolution than you think. So typically, if you're not the squeaky wheel in those situations, you're probably not going to get any grease. So I always tell everybody not to be a jerk, but make sure you're heard and make sure that you're reaching out and asking questions and telling them the issues that you're having because typically they've heard it before and they've probably resolved it before and it can definitely speed up your process and getting acclimated. I know you were talking about your brother, my wife Caitlin. I bet she probably once she was diagnosed with sleep apnea, it probably took her 6 months to even try the CPAP. And we have a
Yeah.
CPAP company. So like I understand people's hesitations because my wife hesitated for a long time. And
Yeah,
then even when she tried it, I'll bet it was 2 months before she went more than 3 or 4 hours without taking it off at night. Probably the
exactly.
first night was 20 minutes or something. But
Exactly. It takes a
6 months
lot of
into
getting
it,
used to.
she wouldn't go without it. We don't go on vacation without it.
Mm,
Um, if we're staying with family or something, we probably have an extra machine there. So
yeah,
it's definitely something that she would consider life changing. But it also, I think she had a very common path in that I don't know that anybody really wants to do it. You know what I mean?
yeah,
But when you experience how much better you can feel, I think that
exactly.
that definitely makes it worth it for sure.
Exactly. I think in our culture, we kind of glorify sleep deprivation. We may hear people say, I only need 4 hours of sleep. I'm doing great. And I would wonder, are you functioning at your highest level of cognitive function, right? How
Mhm.
much better would you function if you slept the full 7 hours that are recommended, at least for adults? We really wear the exhaustion as like a badge of honor. And it's also important to know that sleep changes, our sleep requirements change over the course of our lives, right? And it's if you're a postpartum woman that, is taking care of a newborn, like your sleep requirements will change, your sleep physiology will change where your sleep is more you're more likely to wake up, right? To hearing the baby cry. And
Mhm.
so during that time, like you are going to feel kind of unsatisfied with your sleep. You're going to have insufficient sleep. But when you're dealing with that for years and years and years, it's time to talk to someone, right? Because you
Sure.
could be sleeping so much better, functioning better at work. The National Sleep Foundation does a survey every year looking at sleep in Americans, and they assess recently your likelihood of flourishing, which is how likely are you to feel happy, to feel productive at work, at home, and to enjoy your social connections, right? And if you tend to have poor sleep health or feel unsatisfied with your sleep, you're less likely to flourish in life and feel accomplished in your goals, right? So it doesn't just affect your physical health, but just your overall functioning in life. And when you get people who are satisfied with their sleep, they're 45% more likely to feel like they're flourishing in life. And so that's another fun fact of just the drastic impact that this has on our health.
Yeah, I think it hit me with another stat. It may have been in this conversation or previously, but we spend a third of our life sleeping.
Yeah,
You probably ought to
exactly.
do it fairly well. Yeah, I'll tell you one more story before just kind of getting your thoughts on the future of sleep apnea and some upcoming
Hmm.
treatments and new things. My wife, when she was pregnant, actually had to switch from an auto CPAP to a bi. You were just talking about postpartum. While my wife was actually pregnant, her apnea got so much worse while she was pregnant, I guess just from all of everything's going on there. And
Yeah.
her pressures got so high they had to switch her to a BiPAP, and which was great. It worked out wonderfully. But I think that's another testament to why you stay in tune with your doctor because things change throughout life. I also
Yeah.
tell people like if you hammer a 12 pack of beer before bed, probably going to have a little more apnea at night than if you're
Hmm.
on your regular fitness routine. So I
Yep.
think it's good to stay in tune with somebody that can help you along that
Absolutely.
path.
The 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 physiologic changes that happen during pregnancy increase the risk of sleep apnea significantly. And we know that not treating sleep apnea in that second or third trimester of pregnancy really does a disservice and increases that risk of gestational diabetes because cortisol levels go up when our oxygen is going down during sleep, right? It's a stress inducing state when our oxygen's dropping. So cortisol goes up, blood sugar goes up, higher likelihood of gestational diabetes. So screening for sleep disorders may look different and may be necessary at different points in our lives. And just because we had a sleep study 5, 10 years ago and it was normal then doesn't mean that it's still normal today, right? Going
Yeah.
back to continuing to assess what's going on with their sleep health today and what can we do today to make it better.
Yeah. Cool.
Yeah.
Well, we'll close out here in a minute, but I wanted to get your thoughts on the future of sleep. I know you had mentioned to me there's some things coming through the FDA that may be of interest for people with sleep apneas. Let
Yeah,
me know
so
what you see in the future here.
yeah, so sleep is changing dramatically and fast. We had our first approval by the FDA for Zepbound as a medication to treat sleep apnea. Zepbound is also approved for weight management for obesity. And so in that sense, we get people to lose weight when sleep apnea is related to that weight, excess body weight, then we really decrease the severity of sleep apnea by 50 or 60%. So that's a really exciting treatment that was approved by the FDA last December. There is currently in the FDA approval process an oral medication that is showing dramatic improvements in sleep apnea. And what that one does is it's a pill that two different medications that increase the muscle tone of the airway. And so it helps keep the airway open, decreases the likelihood that the airway closes when we're in that relaxed sleep state. So that's really exciting because it's an oral medication, way more likely that people are going to want to take that rather than wear a CPAP. We still have to, do trials to compare the efficacy of that compared to something like CPAP, which is the gold standard. But it's really an advancing field. The technology for sleep testing is also changing rapidly where you may not have to go into a lab to do a sleep test. You may be able to get the same data, the same type of information from an in-lab sleep study at home. And so that's really exciting. That's called the Onera system, and there's others out there.
Nice. Okay. Yeah, I think people would probably prefer pills if they were looking to do something like that. Especially the what did you call it? Zepbound?
Zepbound is that
Zepbound.
injection. It's a weekly injection.
Um, if they were looking to do something like that, could they do that through you as well?
Absolutely. Yeah,
Okay.
it's board certified in obesity and sleep. Zepbound is really exciting for me because I can help patients achieve a healthier weight, improve their metabolic health, reduce the risk of stroke, heart disease, kidney disease, and also reduce the sleep apnea severity. So it's super exciting.
Yeah, we've had plenty of customers where we follow up and they let us know, hey, I lost 40 pounds and retested and I don't have sleep apnea. So not that I
Yeah.
want to lose customers, but if it's for the better of their health, for sure. Obviously you want people to improve. So if that does, that's an awesome deal.
Yeah, absolutely.
Nice.
Absolutely. And sleep doctors right now with that medication that it's a struggle, right? Because how do we incorporate a weight loss treatment into our sleep practice where we may not have nutritionists or anybody to help patients navigate how fast should I be losing weight? How do I make sure that I don't lose muscle mass as I take these
Mhm.
medications? And so it's combining these two fields is becoming more and more important. And the sleep doctors are looking for obesity doctors that they can refer to, and vice versa. Doctors who have patients with obesity who haven't been able to get on these treatments because there's no coverage for the by their insurance. Now, hopefully, we can start to see insurance coverage for Zepbound
Yeah.
because of the diagnosis of.
Well, with you, they got the combo, two for one.
Exactly. Yeah.
Nice. Well, one more question I have. I hear all the time all these home remedies for helping to get to sleep, stay asleep, whatever, everything from like magnesium to marijuana to anything under the
Mm.
sun. Is any of that something you would recommend as like an over-the-counter first step for people that are just trying to sleep better?
Yeah, magnesium has been shown to improve insomnia in some ways, especially that middle of the night insomnia, so waking up in the middle of the night. It's a muscle relaxant. And so for some people, magnesium glycinate is really helpful. Um, I think more research has to be done on CBD and all of the ways that you can sell that. Some of
Hmm.
them have more THC than others. And so really it's interesting to see how that field is going to change. What I see some people saying is like the CBD gummies may help me initially, but along the way, if we're doing that too much, I tend to see more of anxiety or depression, so more of an effect on mood. I think that has to be better studied. But I would say, I think ruling out sleep pathology comes first. And then we can assess what might be a good treatment for you, depending on how often you might need it. And knowing that people want a holistic natural approach, and so how can we use natural medicines that are out there? I think it depends on the patient. It depends how often we would use it. Marijuana over the long term, it really may cause more cognitive dysfunction, anxiety, and other mood disorders. So I would not recommend that nightly for anybody.
How about melatonin just popped in my head too. I think
Yeah.
yeah.
Melatonin, we often misuse it. Melatonin is the circadian rhythm hormone, right? It's made by the brain when sunlight goes down. So when we're all staring at our phones, we're preventing melatonin production. But because it's a circadian rhythm marker, it actually peaks 3 hours before our sleep onset. So if you're going to take melatonin, you actually want to take a very small dose, like 1 milligram, and take it maybe 3 hours before bedtime. It's
Hmm.
not the kind of thing that will work if you take it as you're like putting your head on the pillow. And so
Okay.
that's another misconception about melatonin.
Nice. Okay. Well, that's good info.
Yeah.
Well, we're going to close it out. I appreciate your time. I'm going to tell everybody that's watching this, if you've got questions about sleep that you think would make, great further conversation with Dr. Guzman here, I'll be happy to do another one of these. So please in the comments, throw us any questions. At the very least, I'll reach out to her and try to get some answers for you guys. And hopefully you found it interesting. If you did, please hit the thumbs up. Subscribe to CPAP My Ways channel for more content like this. And Dr. Guzman, if you would just tell them where they can find you and how to best contact you.
Yeah, absolutely. So you can schedule a consult if you're in Florida or Georgia through telemedicine through my website, dreamlifemedical.com, or you can follow me on Instagram for just good health tips throughout time at DreamLife Medical. If you're in St. Pete, I welcome you to come out to the Walk with a Doc event. It's a free monthly walk that we do at Crescent Lake Park at 9 a.m. on the second Saturday of every month. And we just have relaxed conversations about topics like this, whether it's in the obesity realm or sleep. And thank you, Clay, for really inviting me and giving me this space to talk about this important topic.
Absolutely. Hopefully we'll have some more conversations like this. And if you want to meet
Yeah,
Dr.
I'm
Guzman
excited.
in person, sounds like the Walk with a Doc place to do it. So
Yeah.
thank you again for doing this, and I'm sure we'll talk again soon.
Awesome. Thank you, Clay.
See ya.
Enjoy the rest of your day. Thanks for having me.